We are all well aware of the outrageous waiting lists for medical procedures in the HSE. This has now been ongoing for decades. Over the last 20 years, Fianna Fáil, Fine Gael and Labour are all guilty of failing the Irish people by allowing the present situation to exist. How many health ministers have we had who promised so much and gave us so little? Today there are over 1 million people on the waiting list out of a population of 4.5 million. Unbelievable, unacceptable. Why? One must ask, why is the Minister for Health not held responsible and accountable for the HSE? If the Minister is not accountable, then he has an obligation on behalf of the Irish taxpayer to name the CEO of the HSE as the sole person responsible for all happenings within the HSE. There are gross negligence cases happening at an alarming rate and are never ending in the HSE, and costing the Irish taxpayer vast amounts of money every year. Over the last 6 years, the HSE has paid out over £500 million in claims for damages. Who pays for it? Us mugs. Amazingly, all these cases are called medical misadventure cases. Until we get a case called for what it is, medical negligence, we are going nowhere. Legislation must be passed now and make accountability within the HSE a common practice, with severe sanctions for breach of duty of care to their patients. Nearly 50% of Irish people have private health care. Why? Because we all want to jump the long queues pertaining within the HSE. A high level of healthcare is freely available in the other EU countries. How are all the other countries in the EU able to provide a high level of healthcare? We spend 25% more than all the 35 members of the OECD. In 2017 we spent 15 billion on our health service. The UK has around 65 million people and it is 14 times the population of the Republic of Ireland. Their health bill in 2017 was around 122 billion sterling. Why does Ireland pay over 50% more for healthcare than our nearest neighbour, the UK? 80% of our healthcare goes on salaries for staff, etc., and only 20% goes to patient care. Ireland spent almost 20% of government expenditure on health last year, the largest share on health of any other country in the EU. The Irish people demand that our government tackle the vested interests within the HSE to allow parts of the HSE to close at 4:30 p.m. on Fridays and leave equipment worth millions laying idle over the weekend. A disgrace and a terrible waste of money. In 2008, the HSE employed 320,000 people and the health bill was 18 billion euros. Last year, the HSE employed 128,000 people and the health bill was 15 billion euros. The workforce has been reduced on or around 60%, but the health budget only came down to 12%. Who is kidding who? The vested interests within the HSE have held this country to ransom for far too long. It's time that these vested interests were finally challenged. All equipment should be available 24/7. All consultants should be monitored to ensure that they carry out the required 33 hours per week to stand up to on public patients. Absenteeism in the HSE has to be tackled. It's far too high at present. All members of the public entering and leaving all our public hospitals must wash their hands. A staff member must stand at these entrances and ensure that all people comply with hand washing going in and out of our hospitals. This will go a long way to reducing hospital-acquired bugs and bring down claims we pay out every year for hospital bugs. I've personally watched people going in and out of Beaumont Hospital and a high percentage of people never wash their hands. Unacceptable. Please subscribe to my channel. It will cost you nothing. It just means that all my videos will go to you automatically. My next video will be EU Directive 211/14 EU, cross-border healthcare, your rights under this directive. Bye for now. Talk to you all soon. Thank you for watching and listening.